Hello, I'm Chet, Chief Policy Officer for AMGA, and we're here in windy Washington, D.C. for AMGA's 2022 Capitol Hill Day. It's our first Capitol Hill Day program in 3 years. We're so excited to have the members back talking to members of Congress. We have 40 AMGA members that have over 150 appointments with their Capitol Hill representatives. And they're going to be talking about lots of issues that impact the group practice model. And speaking of issues, I'd like to turn it over to Darryl Drevna, our Senior Director of Regulatory Affairs, to talk about the things that our members will talk about to Congress today.
Sure. I think top of mind is the potential cuts to Medicare that our members are facing. There are three things they need to raise with their members of Congress and their staffs when they're on the Hill today. First off is PAYGO. That's going to come back and be implemented at the beginning of next year. They're facing a 4% cut there. Sequester's already in effect. It's a 2% cut as of July 1 this year. And then we're waiting for the physician fee schedule to come out, and I expect there'll be a cut in the conversion factor. So we don't know what that is exactly yet, but I expect that we're going to look at about 10% potential cuts at the beginning of next year unless Congress acts. And so it's really important that our members explain just how impactful and how devastating that could be to the group practice model.
Yeah, and how they deliver care.
Exactly.
So there's probably a second issue they want to talk about also, Darryl.
Sure. I think telehealth is probably the other issue they're going to bring up with on the Hill today. And we've learned a lot from the pandemic on how care is delivered, how patients like to access care, and telehealth is really a vital tool that our providers can use to make sure they're reaching patients where they are. And there are a lot of flexibilities that came into play because of the pandemic, and we'd like to see those continue on in a post-pandemic world. Geographic restrictions, originating site restrictions, we learned that those just aren't really necessary to deliver quality care. So if we can eliminate those from the program, I think both our providers and patients are going to benefit.
I totally agree. And let me conclude, thank you, Darryl. Let me conclude by saying this. I think the policy staff does a great job of lobbying both Congress and CMS and HHS. But when they hear from you, the frontline providers, and really large employers in the districts and states, that's what the message, that really reinforces the message that we talk about every day. So we encourage all AMGA members to come to Capitol Hill Day next year. We will set up all your appointments for you. We'll have all your issue briefs for you. We'll make it as easy as possible. We'll even come to the Capitol Hill with you. So this is Chet and Darryl signing off from Capitol Hill Day, again, in a windy, lovely day. Thank you very much.
Thank you.